Great. Well, hello, everyone. I am so excited to be here on the call with you today. I've heard great things. I'm Dr. Brittany Volk. I go by Britt or Dr. Britt to many of our patients here at Virta. I am a registered dietitian, a nutrition researcher, and am part of the clinical education team here at Virta. And having spent many years researching the impact nutrition could have in those with metabolic diseases, I really wanted to be able to translate that into how can this apply to everyday life. And so Virta really became the perfect place for me to do just that. And so what I do here at Virta is directly work with our patients to translate the science and engage them in ways that will help them make Virta and diabetes reversal something they can sustain for a lifetime. And I've been working with our patients here since the very first day of Virta, so I'm certainly thrilled to share with you, especially more about our Virta patient experience. And today we'll dive into diabetes reversal, how Virta works, a deep dive into the patient experience. That's my favorite part. And of course, I'll answer any questions that you may have. I just want to reiterate for those of you just joining us, I have allowed you all to have speaking permissions. So if you would like to speak, you can unmute yourself. If you have questions, I'm happy to answer them throughout. I typically will wait till the end, but again, you can definitely unmute yourself and ask, as well as you can put questions into the chat box if you have something you want to remember, but we'll get to it later. So with that, let's jump into it. We're proud to say that Virta is the first and only medical treatment to reverse type 2 diabetes. And as you're thinking of, I should say medical nutrition treatment to reverse type 2 diabetes, and as you're thinking of what it is Virta provides, there are really a few key things that distinguish us. Now, Virta is a fully licensed medical practice with a clinically demonstrated treatment to actually reverse type 2 diabetes. And now, diabetes is fundamentally a problem of blood sugar control, characterized specifically by high blood sugars. And when I say diabetes reversal, I'm talking about achieving normal blood sugars as measured by hemoglobin A1C, which is a 3-month look at a person's blood sugar control, while simultaneously eliminating all diabetes-specific medications. So for someone to have reversed their type 2 diabetes, they have to be below subdiabetic threshold in that hemoglobin A1C and off of all diabetes-specific medications. And because the results we have seen have been so tremendous, both in the short term and the long term, we are able to go 100% at risk for our fees, meaning if a patient on the Virta treatment does not see results, we don't get paid for that patient. We believe in our treatment and we've demonstrated that it works, so we're able to make this bold offer. And now to understand why we at Virta are on a mission to reverse diabetes in 100 million people by the year 2025, it's because the statistics are staggering. It's a disease that isn't going anywhere. The prevalence rates continue to climb. And as you can see here, it ranges at employers from 7 to 20% on average. And it's costing more and more to manage the disease as it progresses. It's not only costly to the employer, but to the patient as well. And beyond pocketbooks and money, diabetes is costly to a patient's quality of life. And people don't really even realize that diabetes reversal is a possibility. So many patients, like Lori here from Nielsen, she is one of our patients, think that diabetes is a life sentence. I hear this over and over again from patients, statements like this. And once we show them that reversal is a realistic solution, something that they can achieve, it's like giving them a whole new lease on life and an outlook for their future. And the reason people don't even know that it exists is because we've really created a new category of reversal. So up until now, the available solutions for diabetes have been either in prevention, attempting to prevent the disease from occurring, which is typically through weight loss, or managing the disease through monitoring blood sugars and improving medication adherence. And patients now have another opportunity in addition to that, which is reversal. So not just managing diabetes. And imagine being diagnosed with a condition you thought you'd have forever and then finding out there's actually a solution and something you can do about it. And so with that, I will dive into how Virta actually works. So there's really two innovations that make Virta what it is. The first is an innovation that addresses the root cause of type 2 diabetes. And for this, we use a highly individualized medical nutrition therapy based in carbohydrate restriction. And the second area of innovation is in our care delivery. So a new care model called continuous remote care. And I'll dive into each of these in the coming slides. But before I do, I like to paint this picture. If you think of it this way, imagine you have type 2 diabetes, and through your phone, you have access to an app that provides not only education and guidance and support to make dietary and lifestyle changes, but it also provides you with a direct line to both a health coach and a provider who can answer your questions and monitor your treatment pretty much around the clock. That essentially is what Virta provides to each and every patient. Sorry about that. Okay, so to understand Virta Reverse, at the core of our treatment is carbohydrate restriction. So guiding patients to what is right for them, and it's highly individualized to each individual. Because let's face it, every one of us on this call even, we each lead different lives. We have different schedules, preferences, and so on. And so we work with each patient to find what's right for them, their lifestyle, and their health goals. And as patients make dietary and lifestyle changes, they track their biomarkers in an app. So things like weight, glucose, and ketones to know how they personally are responding to the treatment. And this allows us to have a feedback loop with the patient and allow modifications to really personalize each patient's treatment as we work to de-prescribe medications and return their A1Cs back to sub-diabetic levels. And this platform, this continuous remote care that we deliver our treatment through, is made up of providers and health coaches who are really metabolic health experts. So we have dietitians, nurses, and PhDs, for example, that are working directly with our patients. And using their mobile device or web browser, as I mentioned, patients really have that direct line of communication to our clinical team. And so it's really 24/7, near real-time treatment, monitoring, and feedback for patients when and where they need it. This allows us to guide them to their diabetes reversal safely and sustainably, both individually and at scale. And speaking of delivery at scale, I'll share with you some of our peer-reviewed outcomes. So for the last few years, we have been conducting a rigorous research study, and it started as a 2-year study and has now been extended out to 5 years. And at 1 year, we're able to show that 60% of completing patients achieve diabetes reversal with a really nice side effect of 30 pounds of weight loss. So weight loss is not our focus, but we're able to, when patients achieve blood sugar control, that weight comes off quite nicely, and it's a really nice, like I say, side effect of the treatment. But I do just want to point out again, so if you have 100 people in a room, we're showing that 60 of those people can reverse diabetes. And so that's at 1 year. Now the rest of the 40%, they're still working on it, but 60% get their blood sugar levels under control. That means they get them below the diabetic threshold for type 2 diabetes, and they're off their medications. And so that equates to far less medications, of course, less medication spends. And people ask all the time, okay, is this sustainable? And we show a very high retention. And people say, is this sustainable outside of your research study? And that retention score that you see right there, that near 90%, is in our commercial population. So we're showing great success. And just for comparison's sake, if you were looking at a drug trial, so simply taking a medication, the adherence for a drug trial is on average 43%. So 43% compared to this 90%, I would say, is pretty significant difference here. And patients are seeing benefits beyond diabetes reversal. So improved cardiovascular disease risk factors. They're seeing improvements in their fatty liver, improvements in their sleep quality. So again, getting these benefits beyond just diabetes reversal, which is our focus here at Virta. Now, that's a bit about our data. So again, I said at scale is important, but let me take it back to the patients, because each and every patient is really so important to us. So I want to walk you through the patient experience here at Virta. And now, first I'll start with who is eligible. So if you're thinking about who you might refer to Virta, people must be between the ages of 18 and 69 enrolled in, it could be an employee, tribal member, spouses, and adult dependents enrolled in either the tribal family health plan or the employee health plan, with the diagnosis of type 2 diabetes and having access to smartphone, tablet, or computer. And I will say here that in terms of those with type 2 diabetes, I will say that people don't often know if they actually have the diagnosis. So if you're talking to someone and they may have a pre-diabetes diagnosis, that does not mean that they should not enroll and go through the enrollment process, which I will walk through here in a minute. Because oftentimes we'll let people know, hey, we looked at your fasting blood sugar, or now your A1C, it was in the pre-diabetes range, but now you've moved into the type 2 category. So I wouldn't discourage people from applying simply because they don't know if they have the diagnosis. Now I want to walk you through a patient here, Wilma. And Wilma is an actual patient of ours. So we don't use stock photos. We use our real patients and our real care team. I describe Wilma as everyone's favorite grandma because as I walk you through her journey, I like to give a little personality to it. Now Wilma joined Virta several years ago at 69 years of age with an A1C well within the diabetes range, weighing nearly 200 pounds, and was taking multiple medications, including insulin. Now, if you know anyone on insulin, you know that it is a medication that, having to inject yourself multiple times a day can be painful and inconvenient and costly. And so insulin is, of course, one of those medications that while it's necessary for those who need it, if we can get patients off of that, that is absolutely our mission here. And so that's our mission here with Wilma, and I will share with you a little bit about how we did that. So patients like Wilma come to Virta through a variety of targeted marketing tactics that we hear from each individual customer what is best for them. So we partner with you to determine what tends to get the most attention with your group. So we have a team dedicated to creating these marketing campaigns, everything from Facebook ads to emails to mailers to posters that we'll hang up. So it really, really is an effort to figure out what's best for your group. Now, once patients are interested in the treatment, they'll go to the website and they'll fill out some very basic information. They will then be assigned an enrollment advisor who will be their single point of contact of who they can reach out to answer any questions they may have through the entire enrollment process. As I mentioned, we're a fully licensed medical clinic. So you could imagine the type of information that we're gathering. We're asking patients to have labs done. We want to make sure we have their medical history. And you know what? It's really nice to have a person to reach out to make sure all your ducks are in a row and that you've done everything you need to before getting to this final step of meeting with your Virta provider. This is done through a telemedicine visit. Your Virta provider will, of course, review your medical history with you, answer any remaining questions you may have, before then approving you for the treatment. Now, once you are approved for the treatment, you will watch this short video that I'm going to share with you right now. The reason I want to share this with you is for several reasons. It really gives you a good look into how patients communicate with us on Virta, how their treatment really works, how the patients interact with both the coach and the provider. It gives you screenshots of the app. So it's a really nice view into what is Virta. And so I will play it, but I will ask that if for some reason the sound does not come through, please let me know through the chat box.
Congratulations on taking a major step to restoring your metabolic health, having more energy, and just feeling better. Let's go over what you can expect while on Virta. The Virta app will provide you with continuous access to your care plan and support systems. The app is filled with resources and tools which help you track your progress and personalize Virta around your individual needs and lifestyle. Your Virta care team includes your Virta physician and your own personal health coach. You will communicate with your health coach through the app using the chat function, which works similar to texting. Your coach will answer your questions, provide feedback and troubleshooting, and help you achieve your goals. Your health coach and physician are in frequent contact about your care and work together to make sure you succeed on Virta. Your physician will communicate to you primarily through your health coach and will also have periodic telemedicine visits with you during your journey. On a regular basis, you will enter biomarker and symptom data into the app, which both your coach and physician immediately receive. Together, they carefully monitor this data, which keeps you safe and allows them to personalize your treatment plan. Joining Virta means changing what you eat, which requires learning new habits. Your educational program will include a series of videos and activities, as well as practical resources like food lists, guides, and recipes. You'll receive an invitation to join a private online community of other Virta patients. The group is an online forum where you can get motivated with success stories, share recipes and food inspiration, build and clarify knowledge, and get peer support during struggles. You can leave at any time, and participation is completely optional. You'll also receive an email with tracking information for your starter kit. Your kit will arrive about a week after the day you were accepted into the Virta clinic. Once your starter kit arrives, you will have all the supplies you need for safe biomarker monitoring. For your safety, do not make any dietary changes right now.
Okay, great. I like to just make one point about that last message of do not make dietary changes right now. It was kind of an alarming caution, I get it. And that's intentional because patients are often so excited at this point in the process to just get going and make those dietary changes. We prepare them, they have the food, they're just ready to get going. And when they do begin, they see such dramatic improvements in their blood sugar and blood pressure. You can imagine, especially those on multiple medications, we want to make sure they don't make dietary changes before we are the ones to tell them to do so that they don't have those dramatic improvements without us being able to appropriately adjust their medication. So that is why we give that caution there at the end. Now, within a few days, patients will receive in the mail a starter kit. This kit contains all of the supplies they will need for an entire year of the treatment. So that includes the glucometer that's going to test their blood sugar and ketones. It includes the testing strips. It includes a cellularly connected scale, among some other tools needed for their treatment in order for us to really personalize their treatment. The next step is one that I consider very exciting, which is meeting their health coach. Now, their health coach is going to be the person on the front lines with them. And for Wilma here, that person has been Catherine. Catherine is one of our highly trained health coaches who really has helped guide Wilma to diabetes reversal. If Wilma has a question, she can reach out and text her just as you would practically text a friend saying, Catherine, here's something I didn't understand, and Catherine can explain it. If Wilma has a question for her physician, Dr. Stanley, Catherine can again be the person to be the communicator with her provider. So Catherine has been there with Wilma since day one. The relationship is so important. And I mentioned some of these, but some key tenets of our treatment is personalized carbohydrate recommendations, eating until satisfied, which is a new concept for many patients, no calorie counting, again, a new concept, and while exercise is great for so many things, it's not required in order to reverse their type 2 diabetes. Now, if patients are already exercising or they want to add exercise, yes, we are absolutely here to help them do that, but we do not require them to do it in order to reverse their type 2 diabetes. And I mentioned the biomarker entries, so glucose, ketones, weight. Wilma is entering this. Early on, she was entering this multiple times a day, especially for glucose. Remember, Wilma was on insulin, so we needed multiple times a day to see when an insulin dose adjustment is needed. That's part of that de-prescribing of the medications, is her telling us her glucose values, entering them into the app, and her care team getting those and able to provide feedback, whether it be a medication change or a nutrition modification. So we can see Wilma's biomarkers since the very first day of her treatment. And by the way, Wilma has been with us since, I believe, July of 2016, so her data stems back quite a bit, and we can make those day-to-day adjustments as well as see how far she has really come. And we're working on things beyond diabetes reversal and, what are your glucose values and how are things going? We're asking, again, how are things going? So how are you doing? If they enter a symptom, say, of a headache, we'll reach out to try to troubleshoot. So we're really checking in with Wilma, not just on how her diabetes reversal is going, but Wilma as a patient of ours in this community. Of course, a lot happens between day one of the treatment, the time, Wilma was enrolled, to then diabetes reversal. But for Wilma, diabetes reversal did happen fairly quickly. So within just a few months, I believe this was at 5 months on Virta, and her video is on our website. You can see her explain it herself, and you can see that vibrant personality come through. But within just a few months, she got her A1C below the diabetes threshold, lost about 40 pounds, and got off all medications, including insulin. So as you can see, that was a pretty big deal for her. And when she says, when my Virta doctor told me I could stop taking insulin, that was the best day of my life. So no longer carrying around those syringes, not having to carry around a cooler if she's going, out for a few hours. So this was really life-changing for Wilma. And for us here at Virta, then it's about maintaining that reversal. So we want to make sure that patients are set up for success for the long haul. And part of that success and what patients continue to work on is, what does it take for me to maintain this diabetes reversal in my life? What does it take? What are the life circumstances I need to deal with? And Wilma works with a team of coaches that help her through this. In addition to that team of coaches, she has an entire community of other Virta patients. So through our online community, patients stay connected and they encourage one another. They share wins, they share struggles, they get ideas and recipes and more from one another. And I always say, diabetes reversal, as cheesy as it may sound, it really does take a village. And that's us at Virta, it's the patients, it's you at MPTN, and it's just all of us working to keep this patient, Wilma, here, and all of the other patients living diabetes free. And that's why, this village that Wilma has is why she's now still living diabetes free over 2 years, almost 3 years later. And, this quote here, I'll just end with this before I take questions. The lives really are transformed, but it is a partnership. And I mentioned the village, and I mentioned you all at MPTN and the patients, because, here's a quote from a patient 2 months on Virta saying, I have more energy, I need less sleep. It's just so much easier when you have a great support system from the health coaches and all of the coaches. So this is a typical patient of ours. If you go onto our site, we really cherish feedback from our patients. And so we have stories, we have videos of patients from, 2 months, like Deborah here on Virta, all the way out to over 3 years on Virta. And so we're really there for the patient as long as they need us and as long as they want to remain in the treatment, which tends to be for quite a while. So with that, I am happy to answer any questions you may have, whether you want to speak, please unmute yourself, or if you would like to put the questions into the chat box, I'd be happy to answer them that way. So if anybody wants to be brave and go first, I'm here to answer. And I will say, if you can't think of a question right now, but you have a follow-up question, absolutely. Our point of contact with you all for here at Virta is Jamie, and she's fantastic. And I will make sure that, she's available to answer any questions that you may have. So. Any questions around the treatment itself, enrollment, eligibility, how you know to refer, like who to refer? Again, I will say with eligibility, thinking about patients who perhaps even have prediabetes, but again, they'll have to have that diagnosis of type 2 diabetes. Okay, in terms of comorbidity, so the Virta provider is the one who will be doing the screening, and I will say there's a list. It's not quite so long, but for example, having active cancer and going through chemotherapy will be an exclusion criteria. Being pregnant right now would be an exclusion criteria. So there's a short list. But for the most part, again, between the ages of 18 and 69, having diagnosis of type 2 diabetes and access to a smartphone, and as long as you're enrolled in a health plan, that would be the criteria for enrolling. And we'll take care of the rest of the screening process once you kind of identify patients who may qualify. Okay, so I know the Q&A box is working. So if anybody else has questions, please feel free to type them in. Happy to answer more. We've got plenty of time. But I won't keep you, so I won't pressure you to ask questions, but I'll give you just, say, another minute, and then after that, please, okay. Yes, so we do have Spanish-speaking coaches, but we do ask that as long as someone needs to be able to translate reading in English, because our app right now is only in English. We have coaches who will do entire, calls in Spanish, but again, safety reasons and protocols require English speaking, or at least being able to read. Great question about having bilingual coaches. But again, it extends beyond the coaching. It goes into the app. So at the moment, being able to read and interpret English. Thank you so much for that question. Keep them coming. All right, let me actually just come back on video here to thank you all for joining. Again, if you have any questions, I'll make sure Jamie reaches out and you'll know who to talk to. I just want to make sure when I leave here, you feel confident in what the Virta treatment is, what we can do for patients, and what kind of patients to refer to, and then what they experience once you do refer them. And I will just really drive home the point that throughout their entire process of, if you think someone could be a good candidate, they will have a single point of contact from the time that they go and enter their information into virtahealth.com/MPTN. They'll fill out that basic information. They'll be assigned an enrollment advisor. All questions at that point, email, phone calls, go to the enrollment advisor. They then get handed off to the Virta provider. That's now their single point of contact. After the provider visit, they will then get handed off to the health coach, which will be their single point of contact then from there on out. And so we just want to make sure that you know that your employees will be very well taken care of from the time they fill out the information to the point of reversal, and then even beyond that. And, as a health coach, I get a question a lot of times of, I have an odd schedule, I work a night shift, and the nice thing is we are available at their fingertips. So if they have their phone in their hands, at whatever time of day, they can communicate with us. They can watch educational videos. They can talk to other Virta patients. They carry it with them all the time. It's like having a health coach and a provider in your pocket. Okay. Well, I don't want to keep everybody. I really appreciate you all sticking around. Again, questions, I'll make sure Jamie reaches out so that you know who to ask those questions to. Patients can, or employees can go to virtahealth.com/MPTN to learn more. And I hope this was very helpful for you all. I appreciate it again. And thank you again for your time. Have a good day, everybody. Bye-bye.